Your cholesterol came back normal, your blood pressure was fine, and you walked out of your medical believing your heart was not something you needed to think about for another year. I want to gently challenge that, because there is a difference between an estimate and a measurement, and your entire cardiac risk picture probably rests on the wrong one of the two. A cholesterol panel does not look at your heart. It looks at substances in your blood and uses them to estimate the probability that you might develop a problem. It is a forecast. What it cannot tell you is whether the damage has already started. For that, you need to look directly, and there is a 5-minute scan that does exactly that, which most executives have never been offered. I am Dr. Mark Holmes, and in the next few minutes, I will tell you the one number that settles the question your cholesterol result can only guess at. Before I go on, if this is the kind of detail your annual medical skips, subscribe so the next video reaches you. And if you would like to see where you stand across the 6 pillars of longevity, there is a free Executive Longevity Scorecard linked in the description. It takes about 8 minutes and it costs nothing. Now, the number itself. Here is the distinction that changes everything. Cholesterol, blood pressure, the risk calculators your doctor runs. These are all risk factors. They estimate how likely you are to have a problem based on averages drawn from large populations. They are useful, but they are a statistical guess about you, not a look inside you. 2 men with identical cholesterol can have completely different arteries. One may have pristine vessels, the other may already have disease building silently. The blood test cannot tell them apart. The scan that can is called a coronary artery calcium score, often shortened to a calcium score or a CAC score. It is a quick, low-dose CT scan of the heart that takes around 5 minutes with no needles, no dye, and no preparation. What it measures is the amount of calcified plaque sitting in the walls of your coronary arteries. Why does calcium matter?
Because when fatty plaque builds up in an artery and begins to stabilize, the body lays down calcium within it, rather like scar tissue. That calcium is a fingerprint. It is direct physical evidence that atherosclerosis, the disease behind most heart attacks, is already present. You are no longer estimating risk from the outside, you are counting the actual disease. The result comes back as a single number called the Agatston score. A 0 means no detectable calcified plaque. A score in the hundreds means a significant burden, and that single number has been shown in large long-term population studies to predict future cardiac events more accurately than the standard risk factors a typical medical relies on. It tells you what is actually there, not what is statistically likely.
There are 2 things you need to understand about this number to use it well. The first is the genuine power of a 0. A calcium score of 0 is one of the most reassuring results in all of preventive cardiology. It tells you that right now there is no calcified plaque in your coronary arteries, and your risk of a heart attack in the coming years is very low. For a man in his 40s or 50s who has been quietly anxious about his heart, a 0 is a result worth having. The second is the honest caveat, and I will not skip it. A calcium score measures calcified plaque. In younger people, plaque can be present but still soft and not yet calcified, which means a 0 is powerful but not an absolute lifelong guarantee. This is why the calcium score is a tool to be read by a clinician alongside your other markers, not a single test to hang everything on. I would rather you understood that than walked away with false certainty in either direction.
So why is this not part of your executive medical? Partly habit. Standard medicals are built around blood tests and the familiar risk factors, and they have been for decades. Partly cost and access, since it requires a CT scanner and a referral most GPs do not routinely make. And partly because, until relatively recently, the evidence was still maturing. The result is that a 5-minute scan with real predictive power sits outside almost every routine check, while men continue to rely on a cholesterol number that can only ever estimate. The point is not that cholesterol does not matter. It does. The point is that an estimate and a measurement are different things, and if you genuinely want to know the state of your arteries, you can stop guessing and look.
So here is what I would do. If your heart has been on your mind and your cholesterol result has never quite settled it, this is a conversation worth having with a doctor who understands prevention. Ask about a coronary artery calcium score. Ask where your number actually sits. And if you want to understand your heart in the context of the whole picture, your metabolism, your sleep, your stress, your strength, the free Executive Longevity Scorecard is the place to begin. It takes about 8 minutes, it covers all 6 pillars of longevity, and it shows you clearly where your strengths and your gaps are. The link is in the description. Stop estimating, start measuring. I am Dr. Mark Holmes, and I will see you in the next one.